If you run a medical practice in Ohio, you already know the front office is struggling. You have open roles sitting empty, and the staff you do hire often leaves within months. This map shows the national trajectory. The U.S. faces a shortage of up to 86,000 physicians by 2036. Zooming in on Ohio, the local impact is already hitting hard, with a deficit of approximately 1,200 primary care providers. When there are fewer doctors to go around, the pressure shifts directly onto the surrounding support staff. This deficit means physicians are spending late nights documenting charts and handling intake, actively draining hours that should be spent in front of patients today. That pressure falls heaviest on medical assistants. Nationally, there are roughly 811,000 MA jobs, and the field is projected to grow 12% over the next decade. But in Ohio, the demand for these roles is aggressively outpacing the shrinking pool of qualified candidates. This chart breaks down what that competition actually costs. The Bureau of Labor Statistics puts the median base salary for a medical assistant around $44,200. But base pay is only the beginning. Add in benefits, insurance premiums, and payroll taxes, and the true cost climbs. Then factor in physical office space, equipment, paid time off, and the management hours required to oversee the role. Finally, add the statistical likelihood of turnover and onboarding expenses. The actual fully loaded cost of an in-house front office hire hits $60,800 per year. That $60,800 number quietly eats into your operating margin, paycheck by paycheck, at a time when practice operating expenses are already rising by approximately 11% across the board. Evaluating administrative roles strictly by an hourly wage obscures the real financial exposure. To understand the true burden on a practice, operators have to look at the fully loaded cost. For most mid-size practices, that hiring process repeats itself constantly. According to MGMA data, 47% of practice leaders point to medical assistants as their absolute hardest role to fill. To put that in perspective, practice managers report that MAs are nearly 3 times harder to hire than nurses. Every time someone leaves, the practice loses the institutional knowledge they built, the patient relationships they maintained, and the weeks of training invested in bringing them up to speed. Looking at the productivity graph here, you can see the financial hit when a turnover event occurs. Recruiting fees and the inevitable dip in output during onboarding cost a practice between $9,000 and $12,000 per lost employee. Relying on a traditional, locally sourced front desk means mid-size practices are paying a premium to constantly subsidize their own operational instability. The instability stems from how the role is structured. A single front desk coordinator is typically expected to field rescheduling calls, verify insurance, coordinate referrals, and answer patient portal messages simultaneously. That is not a single cohesive position. It is 4 distinct jobs forced onto one person. When patient volume spikes on a Monday morning or during flu season, that overloaded administrative queue immediately falls behind. This 3D model illustrates what happens to the workflow. As calls, EHR updates, and triage pour in, the bottleneck forms, directly leading to scheduling gaps and billing delays that drag down revenue by 20 to 35%. Industry data consistently shows that separating clinical duties from administrative tasks and standardizing those workflows significantly improves retention. Forcing one physical employee to manage the entire intake and EHR ecosystem guarantees bottlenecks, drives up error rates, and directly cuts into practice revenue. To bypass this local hiring cycle, many Ohio practices are outsourcing administrative tasks entirely. As shown here, they are moving away from shared call centers and instead utilizing dedicated virtual medical assistant teams that work directly inside their EHR. Instead of a 6-week recruiting and onboarding lag, a practice can deploy these teams and go live within 48 to 72 hours. Before touching a single patient task, every remote assistant completes over 40 hours of training specific to the practice's workflows and clinical protocols. Because they operate remotely, these platforms run under strict data security frameworks, requiring full HIPAA alignment and SOC 2 Type 2 certification. This digital infrastructure allows the platform to integrate AI-assisted tools to speed up throughput. Notice how the system scans incoming documents and immediately extracts key data points, like names, dates of birth, and insurance IDs. Natural language processing then automatically pre-populates those fields directly into the EHR, while the system actively scans for and flags redundant entries. Catching those duplicates early prevents downstream errors that cause billing denials or scheduling conflicts. This model replaces manual, error-prone data entry with a standardized, automated, and highly secure digital workflow. The most direct way to evaluate this transition is to look at the side-by-side math. This matrix compares the two approaches. On the left is the traditional model, carrying a fully loaded annual cost of $60,800 to keep one administrative staff member in the office. On the right is the Staffingly virtual model. A fully benefited, dedicated remote assistant costs $1,800 per month, bringing the annual total to $21,600. That represents a 64% cost reduction, capturing $39,200 in hard annual savings per position. And if a virtual assistant leaves, the vendor provides an immediate replacement. The practice pays zero recruiting fees and experiences no billing gap. The trade-off is straightforward. You sacrifice the physical presence of a front desk employee in order to secure institutional stability and capture massive operating margins. This structure is currently deployed across more than 800 healthcare providers nationwide, offering a proven alternative to the struggling local labor market. Carrying the full cost and risk of an in-house administrative staff is no longer a requirement. Operators can stop subsidizing high turnover and secure their bottom line by integrating a dedicated remote workforce.